I'm Jan Bellows. I'm a veterinary dentist and a small animals dog and cat specialist. I've been a veterinarian since 1975. We've had the pleasure of being involved with uh, Digicare monitoring for at least 15 years. Many of our patients are 3, 4, 5, and even 6 hour surgeries, and we do that every week. We at least have 2 or 3 very long surgeries because a lot of our involved cases are jaw surgeries, and we have to take out jaws, and we take dental x-rays and take out multiple teeth or multiple root canals, and it takes a long time, and it feels good to look up at the monitor and be able to see that the patient is doing well in all respects. And there's so many things on those monitors, and it's just a good feeling as compared to, is he breathing or not, or is the color good or not. That patient that the client is entrusting us with, their dog or cat, many times is the most important thing in their entire life. And it's a great responsibility that the veterinarian has to make sure that it goes as well as it possibly can go. And monitoring is a major part of it. And there's 3 parts to it. There's picking the right patient, make sure that you know what's going on, blood work and x-rays and EKG. Then picking the right anesthesia, which is, each case is a little bit different, whether they're old or young or what stage of anesthetic risk they are. And then most importantly, the monitoring. And a lot of folks don't pay attention to the monitoring after the anesthetic is over, but research has shown that if there's the majority of problems, adverse events happen to dogs and cats after anesthesia, the immediate 20 minutes after anesthesia. So monitoring really, really helps. I'd say the most important thing to me is that we attach the leads to the patient and we get excellent results all the time. We've had other companies that we have leads and they just don't work well. They're very easy to attach to the patient, and the displays that we get, really large numbers, and the sounds that we get from the units really gives me that extra security that the patient's doing well. The unique pleasure of working with Digicare is the customer service. 2 weeks ago, we had a unit that fell off our anesthesia machine, crashed down to the bottom of the ground, and the screen broke. The unit worked great, but the screen broke. And because it was still under warranty and because the company is just so wonderful, they quickly sent a loaner. We had a loaner within a day, and they replaced the screen. And it's just a pleasure to deal with a company like that as compared to many of the other companies that just care about the sale, but they're not really eager to help you after the sale. And with these monitors, there's always going to be problems with the leads, with the hookups, with customer service. You call Digicare and they're right there to help you. We have the Life Window Lite, the 9X, and the Life Window 1. We also use the infusion pumps and the syringe pumps when we do the CRIs. What's really nice compared to other units is that they work when the animal is moving, so they don't have to be anesthetized. So a lot of, in picking the right patient, we want to make sure that things are good before we use the anesthesia. Also, they work really well on low perfusion animals. A lot of veterinarians actually refer patients to us because we work with an anesthesiologist, and they have touch and go patients, which fortunately we've never had a problem with, thanks to our monitoring. And thanks to, probably the most important thing is that the veterinarian needs to trust the results. And we found that Digicare is the foundation, so we can trust those results. And the last thing is that we can create PDF documents. So from the event, it's downloadable, and we could put it on our, we use Avamark software, and we could just download the whole experience there with PDF. There's probably 20 companies that will make monitors, and probably 4 or 5 that really are on the top. And Digicare is on the top of those because the unit is made so solid and so reliable. Any veterinarian can call me and we'll give them our experience. In all the years, we've always had positive experiences. The company must be run by people that really care about veterinarians, and care about animals.